Casey Maxfield for Animal Nursing. We're just going to demonstrate on Chloe here how to apply a muzzle safely. So we've got our appropriately sized muzzle. Just going to slip it on her. Buckle it behind her ears and make sure it's good and tight. Okay, we're going to show that we can how to use our restraint pole here. We're going to get Captain out of his cage. This is all we're doing. We placed it on him, twisted it to lock it in place, and then this will allow me to keep him away from me if he were an aggressive dog. And that's all there is to it. When I want to put him back in his cage, and we'll direct him. Okay, this is our restraint aid. We're going to use a catnapper to get Hugs out of her cage. Step in here where you can see her. Okay. It's like, what in the world is happening? Our urinary catheterization of a male dog. We are going to flush him with an antiseptic solution. And some sterile saline. Okay. Jennifer's going to do this first, and I'll actually probably need Doc. He does not want to cooperate. There we go. Took a few of that back. Alright, so once again we're just gonna gently clean him. Rinse. Whoops. He's not buying it today. We'll clean him one more time. Chris, would you help me for just half a second? You'll have to hold that. I'm going to need you to open up that red rubber.
Okay. Carbs.
Yeah, those are fun. We've gotten rid of the first couple mils. And now we have our free catch sample from Chloe. We're going to do our best to catch, leave it open, catch a midstream sample. Okay. All right, so we're going to get a sterile urine sample from this cat via cystocentesis. Express anal glands on Captain. Sorry, page is very one-sided. Sorry, Captain. These are full again already. Okay, we're gonna trim Chloe's nails. And give her a feel.
No, I need to get back on Facebook and do that today too. Share it some more.
Put your whiskers back. Alright, and this is how we hand peel a dog. Alright, we're going to clean and medicate Chloe's ear. Okay.
Hey, wait,
Hold on.
Hey, wait,
No.
wait.
No. So what are you doing to me? Hold on. Then we're going to apply her medication. Oh. All right, we're going to clean and medicate this cat's ears. We're using ceramine just to help soften up some of the wax down in there. This cat just has some normal waxy buildup in his ears. Apply his medication. All right, we're going to apply our topical medication. This is Advantage Multi. It's a flea and heartworm preventative. So of course we've made sure it's the correct weight range. We're going to part the, and he does have fleas. We're going to part the hair up here. Get it down on his skin, way up here high on the back of his neck so he can't lick it off. Oh, sorry. Okay, so we're going to do our oral gastric innovation, just like we're placing a feeding tube. We're going to measure back here to the 8th rib.
Let me know what you think too, if there's any, if you like it, or if you're having a success, if you think it's helping with some of those clients who are reluctant to vaccinate. Or if you want to change anything as well. It's a beautiful hospital. Yeah, it's really good spray.
Okay, so our tube is in place. We can administer food, fluids, whatever we need to through here. It is important when we remove this tube, after we flush it with fluids, we'll kink that tube and remove it so that we're not allowing her to aspirate any kind of fluid. Okay, this is part of our ocular testing. We're going to stain her eye to check for corneal ulcers. If I can get my strip out here. We have our sterile saline. I'm gonna apply a couple drops here. And apply this directly to her cornea.
Linda, I'm at clinic, Dr. Gober, if I can help you. Let's see, we were putting a splint on his leg, right? Okay. He should be ready to go. Everything was done earlier today. He is awake, and I can see him through the...
You can see there is no stain uptake on her eye.
Okay.
Manometry to determine her ocular pressure. We're going to start off with some proparacaine. And we'll let that take effect for a moment. Okay, we have our toner pen. We have a new tip cover. We're going to calibrate. Okay. We're just going to very lightly touch this to the cornea, her eye. All right. Okay, so her pressure in her right eye is 17, which is within normal limits. And that's it. Okay, we're going to do a Schirmer tear test and determine her tear production. Okay, we're going to hook this to her lower lid and keep it in her eye for 1 minute. All right, this is our enema administration. So we're going to start off by preparing our solution. We have 4 ounces of warm water. And we're using DSS as a lubricant. The recommended mixture is 5 mils per ounce, so we have 20 mils of DSS. Okay. We have our catheter tip syringe and our feeding tube for administration. How we would give him an enema if he needed one. Close her eye on it if she wants to.
I haven't marked this off. I just got the list out of this box.
Really?
Harley.
about 22, which is the high end of normal, right in the middle of our normal range. Okay, this is our subcutaneous fluid administration. We're going to watch the level in this bag drop until we've given him the desired amount. Yeah, that's good.
What video?
Stop this. Okay. Okay, we're going to do a modified Robert Jones bandage. Start off with our stirrups. We're being careful to get all the wrinkles out. Toby, pay attention here.
rub on that some.
Okay, we're gonna remove our bandage. We have our bandage scissors. All right, we're gonna apply a splint to Red Man.
told him we're gonna check it in 2 weeks, so.
It's about to die. The camera.
Keep it up for just a minute. Cover the bottom of this.
Ready? Okay, we're going to place a pressure bandage over the abdomen, starting off with the non-stick pad. We're going to place some rolled gauze here just to focus that pressure. Grab me some bandage scissors, Chelsea. And then we're just going to add some Coflex on top just to keep it where it's supposed to be. Pressure wrap on our belly to stop any bleeding. Okay, so we're going to do a demonstration of how we would triage a patient. Obviously, this is a demonstration. There is Charlie's perfectly healthy, but so in an instance where he were to come in, say he were hit by a car or some other traumatic incident like that, we're going to use our ABC mnemonic. Our A is going to stand for arterial bleeding as well as airway. So of course we're going to check for any arterial bleeding, which should be immediately obvious. Not something that commonly presents in a vet clinic. Most patients that have severe arterial bleeding do not survive long enough to get to the vet clinic. If we notice any severe bleeding, of course we're going to apply pressure to those areas. We'll bandage them quickly and get the bleeding stopped. We also want to make sure that he has a patent airway. If obviously he does. If even though he has patent airway, we want to make sure that he's not having any kind of labored breathing. So, you know, fluid in his chest or trauma to his head or chest could cause labored breathing. So we'll of course check his respiration to make sure that he doesn't need oxygen supplementation via a mask or a cage or anything like that. And then of course C, we want to make sure that his cardiac function and his circulation is not compromised. So again, we're looking for bleeding, we're checking his pulses, we may be placing an IV catheter to make sure that we can give whatever drugs that it is that we need to give. Once we have those three main things taken care of, then we'll move on to things like making sure that, you know, doing radiographs, seeing if we have any herniation, seeing if we have broken limbs, and things of that nature. So generally, like I said, the first things that we're going to check are making sure that his vital body systems are functioning properly. And that's it for Charlie.
Alrighty.
Alright, we're going to do our dental cleaning on Louie. So the first thing that we're going to do, we're going to use our hand tools to try to pop some of the excess tartar off. We're not using the point of it, we're using the side. He's got a bunch of tartar. Okay, we'll use our ultrasonic scaler to finish up cleaning here. And once again, we're not using the point, we're using the side of it.
Sorry.
Sorry. We're going to check his, make sure he doesn't have any pockets. So ordinarily I would clean the outside of these teeth, the inside of the other, flip the patient and repeat the process on the other side before we polish, but for time's sake, we're just going to show that we can show how to use all these instruments before we finish him up.
polish all the clean surfaces of the teeth. Rinse the excess paste off. And then we apply a plaque prevention gel to all the surfaces of the teeth before they're done.
Alright, so a home dental care regimen for owners. Of course, this is typically something, if we're recommending this after we've done a dental cleaning, we usually send them home with some CET toothpaste as well as either a finger brush for cats or a small soft toothbrush for dogs. We recommend CET chews or some other safe chew to help break some of the tartar up on their teeth. There are certain things like dental diets. Science Diet TD can also be used to keep some of the tartar from building up on those teeth. Daily brushing is best if the owner is able to, as often as they can do it, is sometimes the best that we get. There are also plaque prevention gels that they can use at home. You can use Oravet at home. There's a plaque cleanse gel that they can add to their pet's water to help keep plaque from building up.